Hello, everyone. Good evening, and welcome to yet another episode of ICPA Clinical Series. This is the season number 2, and today we are on episode number 6. And in season 2, it is not a pure clinical series, but we have been taking a lot of allied topics which actually help dentists to look at things beyond the mainstream and diversify themselves. So we have had mental coaches, we have had people who have taken a lot of intellectual property rights, and today we are going to cover another issue which is very what you can say intriguing and at the same time very challenging. We are talking about oral pathology, a non-clinical branch of dentistry, which people commonly associate with pure academic stream. And a lot of people think it is not possible to have a clinical practice exclusively dedicated to oral pathology. But today we are going to bust this myth and misconception. Today we have two oral pathologists and clinical biochemists with us. The first one is Dr. Bhuvan Nagpal, MDS oral pathologist from JSS Mysore, and he is the guest speaker of today's session. He was a gold medalist in his BDS, and he has done a lot of undergone additional training, PGT, MSc in clinical biochemistry, and in laboratory medicine as well. And currently, he is the director, quality head, and senior oral pathologist and clinical biochemist in his diagnostic center in Tohana. Am I right?
Yes, sir.
Okay.
Tohana Mangal
So
Diagnostics.
yeah, apart from what brings him here today is not just his center, but his passion to lead a group of oral pathologists who were looking for, they were just contemplating if they can open an exclusive oral pathology practice. And I think he acted like a guide, and he has created a new forte in dentistry, and he launched something called as, he became the founder of something called as Practicing Oral Pathologists and Microbiologists Association, POPMA. He's the founder of POPMA, and I think there are more than 75 oral pathologists in that organization. And with time, I am sure a lot of oral pathologists who connect with this mission will join it, and this group is only going to become larger and larger. So along with this, I will also welcome Dr. Geetpriya Kaur, another MDS oral pathologist. She is also an exclusive oral pathology practitioner. She also has an exclusive diagnostic center. And apart from this webinar, I also have connection with Dr. Geetpriya in a different way. That is, I am the executive editor of Dental Tribune South Asia, and she is the section head for microbiota, the gut microbiome, dysbiosis, and autoimmune diseases. She has been writing very high value articles every month in Dental Tribune, which are widely read as well as appreciated. So, without taking much time of yours, I'll hand over the session to Dr. Bhuvan Nagpal, who can start his session and enlighten us on how he had his journey, how he could overcome the challenges and successfully run his oral pathology practice. And once this session is over, I'll come back with Dr. Geetpriya to take questions from our registered delegates as well as the live audience. Over to you, Dr. Bhuvan.
Okay, thank you, sir. Thank you so much. Good evening, one and all. I first of all, I would like to express my gratitude towards Dr. Rajiv sir and Dr. Geetpriya ma'am for giving me the opportunity to present and share my views in the form of a presentation regarding the oral pathology practice, which is made possible in India. And how I'm going to go about this presentation is by explaining my journey, what all experience I had in the medical diagnostic industry, along with the legal considerations. Because whomsoever I meet, the first question is whether we can sign or not. This is a burning question in majority of the oral pathologists, and today I'm going to reveal about this thing in detail with all the legal considerations. So it's going to be a bit of like lot of statutes pertaining to the legal considerations will be there. चैन से सोना चाहते हैं तो जाग जाइए. ये this was the a line used to come in a news channel. So taking that as a metaphor, अगर साइन करना चाहते हैं तो ओरल पैथोलॉजिस्ट जाग जाइए. I dedicate this presentation of mine to the first oral pathologist of India, Dr. H.M. Dolakia sir, and all the fraternity of oral pathology. I also dedicate this presentation to Dr. Stanley Robbins and Dr. Ramsey S. Cotran, because they are the ones who have written the masterpiece of pathologic basis of disease, which is a ready reference for all the pathologists, whether any specialty pathologists all over the globe. Now I have a quote. No one can destroy iron, but its own rust can. Likewise, none can destroy a person, but his own mindset can. So this presentation is all about the mindset. And mindset is everything. You can become a tiger with that, or you can be a kitten with that. So you have to change your mindset, and you have to see the presentation with a broad and an open mind. So without wasting much time, I'll just share my journey, because I don't find a better way to express the different statutes or the different kinds of thing without telling my own story. So immediately I passed out my PG. After that, I had many options. I'll discuss later with and won't go much into the depth of that. Another 8 days, I got a job by my own will that I wanted to practice as an oral pathologist. So I approached a diagnostic center with the name of Mangalam Diagnostics, which is a prominent diagnostic center in my city, and it's a 30-year-old reputed chain of diagnostic centers with lab, radiology, nuclear medicine, and blood bank. I got exposed to different branches of the laboratory medicine, which includes hematology, serology, microbiology, not only histopathology and cytopathology, but it includes a variety of different allied aspects. And I proved my worth with my hard work and dedication. So it's a complete set of diagnostics and diagnostic modalities, and I must say that it is the first and only diagnostic center in India per se, which has all the diagnostic modalities under one roof. Because the PET scan has made it like this. Otherwise, PET scan, they are majority of the times in a hospital setup. This is the fact I'm saying when I joined the Mangalam Diagnostics in 2016. So this is the photograph of our different centers, and you can see the different doctors which are there, and in the center is our managing director, Dr. G.R. Gupta sir. So initially, I joined as a consultant oral pathologist, get promoted to the lab administrator, involved with the quality part, and become a quality manager. Then, after that, seeing my dedication, I was given the charge to establish different new diagnostic centers from scratch with pathological and radiological facilities. So the center we have as of now 9 diagnostic centers, and the ones which are in the red, the 7 diagnostic centers, are the ones which I have established from the scratch and rose to the level of chief administrative officer along with the medical legal consultant. And in 2018, I became the director of my own lab in partnership, and that is Tuhana Mangalam Diagnostics. Along with that, I have stake in Hansi, Munak, and Gene Center also. Now, my diagnostic center is Tohana Mangalam Diagnostics, and it is a NABL accredited diagnostic center, which is in the name of ISO 15189 2012 certification. And I passed the competency exam when the assessors came for the NABL accreditation, and I became primary NABL approved authorized signatory for lab reports. My scope is hematology, clinical biochemistry, clinical pathology, infectious disease serology, microbiology, and I do histopathology and cytopathology, but that is not in the scope of my diagnostic center, Tohana Mangalam Diagnostics. And my name is registered with Clinical Establishment Act with the District Registrar Authority. And this lab is the first and only enable accredited medical lab in Tohana or district Fatehpur. This is my team of lab technicians, including a technical manager and the lab manager, and everything is available on the website. I have my own oral pathology practice with the name of Center of Oral Pathology and Maxillofacial Diagnostics, which is COPMD. So that is COPMD for the diagnosis of OPMDs. In that, I do clinical and histopathological evaluation for the OPMDs, cystic lesions, large swellings, benign and malignant tumors, the cysts and tumors of odontogenic origin, salivary gland disorders, tumors, whatever the histopathology, cytopathology from oral head and neck region that I consider under this center of mine. I have my separate objectives for this practice, and that is to establish a critical and precise connection between oral health and systemic health. And I'm very considerate about diagnosing these systemic diseases by their oral manifestations, which is a well known fact. And I also ensure optimal patient care through the accurate diagnosis of diseases affecting oral and maxillofacial region, to provide a center of dissemination of knowledge through his archived collections that again I'll tell I have an academy with that, and to promote oral pathology and microbiology as a specialty of pathology, to provide the state of art comprehensive clinical and histopathologic consultations to hospitals, and to encourage collaboration and interaction with different healthcare professionals. Recently, I have established, or I am the founder of POPMA, that is Practicing Oral Pathologists and Microbiologists Association. It's a professional body of practicing oral pathologists and microbiologists in India. As of now, we have 73 members from 17 different states, and it is a registered uh, society under Haryana Registration Regulation Societies Act 2012, dated 29 September. And the prime mission is to promote the specialty oral pathology practice and empowering oral pathologists in India. The main concern for making this is to safeguard the legal interests of oral pathologists who want to practice this subject. Under the banner of POPMA, we have an Academy of Oral Pathology, that is Academy of Oral Pathology and Lab Medicine, which is again ISO certified. And we have different observership and fellowship courses for that. So those who are not empowered during their times, or they feel lack of confidence, so we have made separate courses pertaining to the lab medicine, in which they can get exposed to the different areas of the lab, a medical laboratory. So this is my final till today is my business card, and I'm quite proud of it. And the purpose of showing is not to boost myself, but to say that when I can do, every other oral pathologist can do. It is not that I am the one who is very great at it. Any oral pathologist can become great by achieving all those things through their hard work and dedication. Now, you see that this is a iceberg illusion, in that the success you have seen, oh, this man is doing the practice, he's the signatory and lot of stuff. So the tip of the iceberg, which is outside the water, the double of that is beneath the water. So, what all challenges I have faced during this course of time, what all disappointments, what probable solutions I came, and to overcome those disappointments and those challenges, that I am going to discuss now, and that must be some questions in the audience mind also. So, what were my challenges? Initially, I was supervising, but I was not signing lab reports. I was managing all the routine laboratory, technical, and administrative affairs, but I wanted to sign the work which I am supervising. So, why is signing lab reports important? Because if I am doing some work and I'm not signing, so what value I have with that? So to make my own thing which important, that's why signing is important in one aspect. And the other reasons, when you sign a lab report, when somebody signs a lab report, so that person accepts the responsibility for the content of the report. And those who don't sign, it gives a loss of confidence in the report. And lab reports, before being dispatched, they are subjected to a kind of check. So that signature should be the evidence that that medical check has been carried out before dispatching that report. And that checking requires a medical as well as a technical knowledge. So at last, signing a report gives us the validity and the credibility for the content of the report. Now I understood that running away from the solution only will increase the distance from solution. Anyways, I got the job. I was not signing. People were telling why you are bothered, why you want to sign. Those were the things which were continuous by different people. So running away from the solution will increase the distance from the solution. So the easiest way to escape from that problem is to solve it. So with that, I have a different story, which is I have named as RTI story, and that is Right to Information Act 2005. The first RTI was filed by me in my second year of PG, and that is 3rd March 2015. In that, I have asked, filed that RTI to DCI, and in that I have asked what is the scope and what all um, different investigations that as an oral pathologist we can sign. But the reply which I got said that you have sought information which requires the interpretations of the acts and regulations of DCI curriculum. So that is not permissible. So then I changed that format and I filed different RTIs to DCI and MCI. Again, the responses were not that conclusive. But I know that we are performing different investigations in colleges. So why not ask the colleges directly? So I filed different RTIs to 46 dental colleges which have PG with oral pathology department. And in that, 22 government colleges and 24 private dental colleges. And the replies which I have got, I have compiled an analysis with that. I'll share with you that analysis. I have written letters to Ministry of Health and Family Welfare regarding the Clinical Establishment Act. And this act was first passed by 2010, then 2012 and 2018. And after that, the latest amendment is 2020. So in that, even the MScs and PhDs, they are given the opportunity to sign the reports. But MDS oral pathology was not at all a part of it. That's why I've written different suggestions and written different emails to the Ministry of Health. And that is also being considered that the Ministry of Health, they have two meetings which were held in 2017 and 18. Those results also I will show. In that, MDS oral pathology has been accepted as a authorized signatory. Written mails to NABL because before 2000, 2020 or 2018, even MSc and PhD, they can sign as per NABL with certain amount of experience. Then lastly, I have prepared the writ petition. We have 5 different types of writ petitions. So I have prepared one writ petition that is mandamus. Till now, I have not had the opportunity to do that, or till now that the need has not came. So I just tell in brief that mandamus is that writ petition which in which two different laws which are conflicting each other. So our DCI says that we can sign, but MCI or the other statutory body, they says that the other person can sign. So just to avoid that part, this writ petition was being prepared. So what are the different favorable solutions which I could figure out during my experience? That is the disease burden. That oral health conditions, according to 2020 WHO fact sheet, we have different kinds of oral health conditions like caries, periodontal diseases, oral cancers, and HIV oral manifestations, which are of particular relevance in India. And you can see that the global burden of disease study 2017 estimated that oral diseases affect close to 3.5 billion people worldwide, and the total population of the world is 6.3 billion. So again, caries and periodontal diseases, they constitute majority of the oral health conditions, and WHO sums it up as oral diseases pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. Now see the head and neck pathologies or cancer. We everybody know that prevalence of oral cancer and other head and neck pathologies are very high in India. The head and neck cancer burden in India is the one third of the global cancer burden. And oral cancer, it is as per the Globocan 2022, the lip and the oral cavity cancer, they are the second most common cancer for both the genders. And they constitute 30% of all the malignancies in our country. And as per Globocan 2020, 2.1 million new cancer cases will be there in India by 2040, which will be an increase of 57.5% from the year 2020. So, such a great amount of increase in the number of carcinomas, and particularly from the head and neck region. And my experience, which I have, like I do a lot of head and neck FNACs, so I have my own study from the archival records, and which says that 65% cases are, they constitute head and neck region pathologies. And in that I have categorized that the head has 20%, which may be preauricular, infraauricular, submandibular, submental, scalp, temporal, infratemporal. Parotid constitutes 3%, neck is 29%, thyroid 13%. The rest others are breast is 27%, axilla and others 8%. And the spectrum of lesions which we have is, the most common is the reactive lymphadenitis. Tuberculosis, India is full of tuberculosis. And second is the metastatic carcinomas with the primary unknown or metastatic squamous cell carcinoma. In thyroid, majorly colloid goiter, nodular goiter. In parotid, pleomorphic adenoma. And yes, there is a huge rise of lymphomas, be it Hodgkin's lymphoma or non-Hodgkin's lymphoma. Other than that, different lesions are there. Then I want to point out one important fact, that is the specialty practice of the domain of oral pathology is not only about oral head and neck histopathology and cytopathology, but it also includes hematology, clinical pathology, clinical biochemistry, serology, microbiology, and even molecular diagnostic techniques. Now, there are so many patients. Now, today, I should tell you that today my day was full of oral pathologists. Today morning, I got a call from a dental surgeon, and the picture which he sent was strawberry gingivitis. The patient has full mulberry like lesions from different, the complete gingival area was full of strawberry gingivitis. And the first thing which came in the mind was a CBC, not even the histopathology. Yes, histopathology is a part, but we need the knowledge and to execute the other allied pathological investigations to support our diagnosis. So that was the DD which I took for that case is Wegener's granulomatosis, and in that it's a multi-disease, multi-organ failure disease which includes a pulmonary relation, even biochemistry, renal function test has to be done, urine analysis has to be done for that case, and different serological markers like C ANCA or P ANCA has to be done for that case. Likewise, even for Behçet's disease, there is a molecular marker which is HLA-B51. Now, this test is particularly for Behçet's disease, which includes genital ulcers and oral ulcers. So now, how we will categorize? So, oral pathology is again an overlapping branch. That again I'll show how it is, and I'll prove that. Oral pathology is an overlapping branch of dentistry as well as pathology, and in turn a branch of modern scientific medicine. Now, legally, I should tell you one thing, that whenever the court of law, they say that you signing reports is amounts to the practice of medicine. But as a oral pathology, when we are signing either a histopathology report, cytopathology, or any other lab report which is under our preview, So that amounts to the practice of modern scientific medicine. So we have to make it sure that dentistry is a part of scientific modern scientific medicine, and oral pathology is part of both medicine as well as pathology. Now you see that the different statutory bodies, first is MCI. MCI has a guidelines for teachers 1998, and that it's published in the Gazette of India, and that says that dentistry is one of the recognized branches of modern scientific medicine and taught during phase 3 of MBBS curriculum as a part of surgery. Now IMC Act, Indian Medical Council Act 1955 is being 1935 is being repealed, and it is replaced by a body, National Medical Commission, which came in 2019. And according to NMC, the guidelines for teachers eligibility qualifications 2022, it says clearly, it is mentioned that dentistry is one of the 29 broad medical specialties. And as we know that DCA is already categorized oral pathology as one of the recognized branches under dentistry. Now recently, last year only, a landmark judgment was passed by Madras High Court, and which says that BDS is also a system of medicine dealing with dentistry. It is a recognized modern system also. What happened in Tamil Nadu? There was vacancy for few food safety officers, and in that even BDS people have applied, and they have the eligibility criteria as degree in medicine. So what happened? The BDS graduates who have applied for that post, those applications were rejected. And they have filed a mandamus writ petition in the Court of Law, that is Madras High Court. And the bench said, the Honorable Court said that you can see that the Section 2F of Indian Medical Council Act 1956 says that medicine means modern scientific medicine in all its branches and includes surgery and obstetrics, but does not include veterinary medicine and surgery. And the NMC Act 2019 also retains the very same definition, which is evident under Section 2J. Sorry, because these are the law statutes, so I have to read them out, and please take interest to listen those things, because these are the things which are going to defend you from pursuing the signatory part. And now the expression degree in medicine will be used as a broader sense, and which will include not only degree in Siddha medicine but also BDS. So again, BDS is a system of medicine dealing with dentistry. It is a recognized modern system also. And the fact that about oral pathology, it is acknowledged and recognized by Royal College of Pathologists UK. You can check on the net, like the different branches of pathology, whether it is dermapathology, hematopathology, neuropathology, nephropathology. Oral pathology is a specialized branch. Again, it's a branch of pathology and dentistry. Now we have to see and have a look at the different things which are being written in the documental proof and which empowers oral pathologists to sign the reports. First is our DCI curriculum. The DCI curriculum, which is published in the Gazette of India, Extraordinary Part 3, Section 4, under page number 87. The two objectives which are written in the front says, I'll read them out: to train a postgraduate dental surgeon so as to ensure higher competence in both general and special pathology. See, both general and special pathology dealing with the nature of oral diseases, their causes, processes, and effects. Second objective says oral pathologist is expected to perform routine histopathological evaluation of specimens relating to oral and perioral tissues, and to carry out routine diagnostic procedures including hematological, cytological, microbiological, immunological, and ultrastructural investigations. On page number 91, routine hematological tests and the clinical significance of the same. On page number 91, again under the section of clinical pathology, lab investigations, hematology, microbiology, and urine analysis. I request all the oral pathologists, all the viewers, to go back and see the regulations published by the Gazette of India in 2007 and 2017. These are mentioned under the page number which I am saying. Again, page number 94, clinical hematology under the exams. HB, BTCT, TLC, DLC, ESR, smear preparation, cytology, or microbial smear. Histopathology, slide discussion. Even the DCI BDS internship regulations, page number 15, says the intern, a BDS intern, should be trained in blood, urine, and sputum examination, exfoliative cytology and smear study, biopsy, laboratory procedure, and reporting. These are the 25 different domains of the subjects which are published under the MDS course regulations by DCI for the subject of oral pathology and microbiology. And as per the DCI revised MDS course regulations 2007, oral pathologist should have adequate training and competency to report the following, that is histopathology and cytopathology from oral and perioral tissues, routine hematology, clinical pathology, routine microbiology, routine serology, routine clinical biochemistry, molecular pathology, and ultrastructural investigations. Even the DCI Code of Ethics 2014, which is amended from the Dentist Code of Ethics 1976, page number 25, under heading 8.3, it says a dental surgeon shall not claim to be a specialist either through displayed signs or the name board or the office stationery unless he has a special qualification which is recognized by the council in that specialty. And a dental surgeon can, however, practice all the branches of dentistry provided he shows adequate qualification, competence, and bona fide training in the concerned branch. There was one more RTI which was filed to DCI, and in that the different scope or the different investigations which was being asked, what all MDS oral pathologist can sign. So the reply was a dentist can perform all the procedures, whatever is present in the syllabus or the course curriculum of MDS oral pathology and microbiology. This is the analysis which I'm sharing you from, compiled from all the different RTI replies which I've got from government dental colleges pan India, from Kashmir to Kanyakumari and from Agartala to Ahmedabad. Histopathology, cytopathology, they're saying FNAC and histopathology from oral head and neck region, maxillofacial, including special stains and IHC, exfoliative cytology, hematology, CBC. Majority of the colleges have signed that they are doing CBC with an automated cell counter, including an ESR, BTCT. Clinical pathology, urine and sputum examination, Montu test, Zank smear. Clinical biochemistry, sugar is regularly performed by majority, and bulk of the colleges they are doing lipid profile, LFT, RFT, HbA1c, serum iron, different enzymes. Serology, that is triple H, HIV, HbSAg, HCV. Microbiology is, they have mentioned basic microbiology in which oral bacteria or fungal isolation. Molecular pathology, ultrastructural investigations, they are not done by majority of the colleges. Like 95% has declined that, and some have said that PCR based investigations for PG academic and research requirements, not for diagnostic purposes. Then all the reports which are being performed in the dental colleges, they are signed by qualified oral pathologists. They hold a MDS degree in the subject of oral pathology, and they are signing those reports from past many years, which are referred to Department of Oral Pathology in both government and private dental colleges. And as per DCI curriculum, the minimum qualification for any teaching faculty is MDS. And I must tell you that I have compared the MDS oral pathology curriculum and MD pathology, general pathology curriculum as per MCI. The only difference lies in the histopathology part. Otherwise, except other many investigations are same. So we should be allowed for the investigations which are not in the curriculum of MDS or not in the preview for MDS oral pathology. Now, I want to point out those facts. When the DCI or the law can allow a dental surgeon holding either a BDS or MDS degree to sign death certificate and age estimation certificate. You can go to the website of DCI that a dental surgeon can certify death certificate and even age estimation certificate. And both these entities are medical entities. So why not lab reports? So MDS who is specially trained, MDs oral pathologist who is specially trained in general and special pathology, they can sign the lab reports. Then the different letters I have written to Ministry of Health and Family Welfare under the meetings were held in on 1st November 2017, and the meeting held on 8th March 2018. And that meeting was in respect of medical diagnostic laboratories, including the signing authority or the technical head of medical diagnostic laboratories for the subcommittee. So that was pertaining to only medical diagnostic laboratory for the signing authority. And it is considered under that meeting that the signing of lab reports by those doctors holding MD's qualification in oral pathology, it may be allowed as per DCI. All these documents are available on the public domain in my website, as well as on the POPMA website also. Now, just to summarize all these acts, I just want to tell that what is permissible under the court of law. The court of law admits the documents as an evidence under the section 62 of Indian Evidence Act 1872. That is the primary evidences which we have. Primary evidence is the one which are the acts which are being passed directly by the government, which includes the DCI MDS regulations 2007 and 17, DCI BDS internship regulations 2011, DCI Dentist Code of Ethics Regulations 2014, the minutes of meeting of Ministry of Health and Family Welfare 2017 and 2018. And there was one NABL approval letter to DCI which stated that MD's qualification can serve as authorized signatory for lab reports, but only for histopathology, cytopathology, and in hematology, some few tests were there, and the clause was there referred by dental professionals, 2018. And I must tell you that this part is not at all recognized as of the moment because Clinical Establishment Act is into the picture. Now, the secondary evidence is the RTI replies, which I have got by the different prestigious government dental institutions from different parts of India. The RTI reply, which states that a dentist can perform whatever is there in the syllabus, and even the NABL decision letter, which has granted accreditation to my lab, that is to Hana Mangalam Diagnostics, in which I am being served as the signatory. Initially in 2022, I was among the co-signatory, like I was among the primary and secondary signatory, but in 2024, I became the primary signatory. So the secondary evidence is like the information which is obtained under RTI Act is part of the documents held by public authority who are gazetted officers. A certified copy of the document received by virtue of RTI Act is secondary evidence as provided under Section 63 of Indian Evidence Act 1872. So they are accepted as the secondary evidence in the court of law since it's a part of government records provided by government authorities certified under government seal. Now, by all these documents, we should have that Atmanirbhar oral pathologist feeling because we need not to depend on any other part to sign the reports because even our different segments or different proofs they say that we can sign the reports. So instead of job seekers, which is a common thing that initially when we pass out we have to seek a job, yes, that is true, but long run, why can't we become a job provider? So to conclude, please listen my conclusion very carefully. I must say that overlapping scope of practice is a reality in a rapidly changing healthcare environment. Several health sciences and medical technology professionals, they are playing a key role in diagnosis, treatment, and patient care. And no single healthcare professional can claim an exclusive role in diagnosis and treatment. The criteria related who is qualified to perform functions safely without risk of harm to the public are the only justifiable conditions for defining scope of practices as per suggested parameters. And competency is someone's subjective dedication and ability, not based on qualifications only. And it is rightly said survival of the fittest, so the competent people will survive. So if you are competent and if you are trained for that, you are allowed to sign. And oral pathologists, they form the qualified healthcare and laboratory professionals who are authorized to sign lab reports, and they can play a major and important role in medical diagnostic industry. For some people, I just want to briefly tell about the different career opportunities. Yes, oral pathologists, they can set up their own labs. They can work as consultant in diagnostic centers. They can work as oncohistopathologists in cancer hospitals and oral cancer centers. They can work as lab administrators in labs, quality managers in medical laboratories. There are different courses by that. Even we have a course at IIM Ahmedabad for lab administration, and different agencies are there which offer courses for ISO 15189 training. And consultant in dermatology clinics. There are specially dermatology clinics who hire oral pathologists and to see the oral lesions. Then oral pathology consultations, either offline or online, even research, ICMR, National Institute of Virology, IIT, NIT, and other institutes of national repute, even embryology lab and stem cell research. Oral pathologists have a great role in that. Pharmaceutical industry, pharmacovigilance, forensic odontology, medical publishing industry, oral biology is a coming part, and soon maybe it will be a separate subject. Medical transcription, online teaching, conventional academics is the one, you know, that to become a teacher in a dental college, medical insurance, and academic administration. And it does not only include the academics, the conventional academics, and academic administration does not include only the dental colleges, but they include the paramedical courses also. I am a guest and the adjunct faculty for paramedical institutes also. So these are my self initiatives, and I request all the senior faculty who are viewing this video that please try to broaden us the scope of oral pathology and make it more comprehensive and practical. Increase the interest of students towards the subject during the initial years of BDS. We have to tell the undergrad students that oral pathology is not about reading a textbook of Schaeffer's or Neville. It is beyond that. Make them aware about the different investigations which are under the part of oral pathology at UG level, and to create awareness about our specialty of oral pathology among our professional colleagues and general public. So, to conclude, I must say that believe in yourself, your abilities, and your own potential. Never let self doubt hold you captive. You are worthy of all that you dream of and hope for. These are my references. And yes, I will take the questions. Thank you so much.
Thank you, Dr. Bhuvan. Looked like you are on a mission. It was amazing to see your journey. And
Thank you, sir.
now your presentation is gone. Only you are visible on the screen now. If you can minimize your screen. And that was an amazing power-packed session.
Thank
And
you, sir. I know there's so much of statutes which every time I meet any oral pathologist, so they have these kind of doubts, but without showing those things, because we know that curriculum is there, but people don't read that. So I
yes,
have to make them read that thing.
but amazing effort. Kudos to you for carrying out this mission and as well as
Thank you, sir. Thank you so much.
inspiring so many others. And at this moment, at this juncture, I would like to welcome Dr. Geetpriya Kaur, another MDS oral pathologist practicing exclusively oral pathology. And let us start with the question and answer session. There are 150 registrations for this lecture. 150 is a very big number. This number is as good as the number of registrations we get for any clinical topic. So this number alone says that this topic is very, very, what we can say, essential as well as thought provoking. So I must congratulate you for coming up with this mission as well as driving people, making people curious enough to come and register for this webinar.
Thank
And
you, sir.
let us start with the questions. The first question is: should we merge oral pathology with oral medicine?
Shall I? I have to. I'll take this question, or
Yeah, yeah, yeah. Both. See, you can
see
answer
if
it. Dr.
you
Geetpriya can
ask
give her
my
own. You
See, if
point.
you ask my personal opinion, I will suggest that we should not merge, because oral pathology has its own charm. Because what we are doing is at the microscopic level, and what oral medicine people are doing at the macroscopic level, and they deal with the treatment aspect. I know in some countries it is being like it's together. Rather, instead of merging oral pathology, I am of the opinion that oral medicine, radiology should be separated. Oral radiology should be a separate branch, and oral medicine. These are my personal opinion.
Great. Okay. Next, is there any chance to practice as an
Yes,
oral
yes, of
pathologist in
course.
Chennai?
I know two on this platform. I cannot take the names, but I know two oral pathologists who are working in Chennai, and that too in a reputed enable accredited diagnostic centers.
Great, great. So there is definitely a scope.
It is not at all about. I must tell you, sir, just to add that people have the doubt that maybe Dr. Bhuvan is working in the north area. That is why there are a lot of scarcity of pathologists. No, it is not so. It is the
Okay,
condition is same everywhere. Likewise, I said that oral cancer is common from Kashmir to Kanyakumari and Agartala to Ahmedabad. So it is the same. The scenario is the same. The
okay,
hardships which a person is facing in the northern part is same in the southern part also.
okay. So basically, any city can have an oral pathologist because need is everywhere. Struggles will be
Yes,
common everywhere. You just need to persist and make sure that you are doing the right kind of things. Obviously, you are going to develop
yes.
your practice.
Or sir, I just wanted to tell that what is your right? No, people will not give you on your plate. You have to snatch your right. So please strive aggressively for that.
Great, great. Okay. Are oral pathology consultants being paid reasonably compared to other specialist consultants? It seems like a Herculean task to even convince fellow dentists to pay us handsomely.
So I would like to answer this question.
Oh, yes.
I,
Go on,
I,
please.
Yeah.
yeah, I believe that oral pathology consultants are really required because it is the way we can. It just depends on how we market ourselves in the, like, how we show clinicians that we are also capable, and like we just have to tell them that what all facilities we can provide to them. And I'm sure because my journey also started like that. It was a bit struggle in the beginning, but then like people start trusting you, and that's how you grow your network.
Great. Next question. Which are the cases we should take in our general dental clinic? Maybe they want to ask which are those cases which they should consider as an oral pathology case and refer it to an oral pathologist.
So I think for the clinical part, mostly because I think they encounter OPMDs most commonly. So they can
I
refer,
think
they can send
is
biopsy sample.
the question is not quite clear. What, which are the cases we should take in our general dental clinic?
So
Uh,
I interpreted it as which are the cases that come to general dental practice that they should consider worthy of sending to a oral pathologist. What cases they should suspect? If you can give
okay.
some tips.
So
All
I
these.
think, uh, sorry,
Yes,
you
Dr.
continue.
Geetpriya, please go ahead. Please go ahead. Sorry for the interruption.
Yeah, any red and white lesions, like to be specific, because that is the most common finding in India. Like, and any kind of discoloration, if they can notice, they should send that also. Or any they feel there is any growth, or because generally what I have seen from my practice is that people are suspecting just leukoplakia, but once the lesion reaches to the clinic, it is diagnosed as cancer. So it's better as early as the diseases can be diagnosed. So the prevention will be better.
Okay. Dr.
Sir,
Bhuvan, you
can
want
I
to add
add
something?
a bit
Yeah,
of
please. Yes, please.
a mantra for all the viewers?
Yes, please.
Yes, I must tell you that whatever you are seeing macroscopically will be a misnomer, or it will be very misleading. Any desquamative gingivitis can present as a pemphigoid, can present as a squamous cell carcinoma, can present as a Wegener's granulomatosis, can present as a allergic mucositis. But your naked eyes cannot distinguish that. So please keep trust on your oral pathologist. Do a biopsy. Biopsy is highly recommended, and it should be made compulsory, because and you will see, sir, because you are in the world of AI and I'm dealing with lot of tomorrow you will have some AI app also which will tell, oh please, this is a recommended case for oral pathologist,
Yes,
because
yes, yes.
yes, it will tell. And I must tell you that what is happening at the tissue level is entirely different. I've seen a fibroma looking like lesion turning out to be a squamous cell carcinoma, and even a angry looking lesion coming out to be a in granulation tissue. So always see at the tissue level. That is my take, sir, on this aspect.
Great. And the next question is about biopsy only. The question is how to take a biopsy for OSMF lesions. Any
Dr.
particular
Bhuvan, would you?
guideline you suggest, you recommend to the clinicians that if you have to give this kind of biopsy, that will be good for interpretation analysis?
Dr. Geetpriya, you want to take on that, or I should?
No, it's okay. You continue. You
Okay.
continue.
So any lesion, it will be like it's gonna be the same. You have to select the representative area. It should be from the margin. You should take either a punch or any scalpel biopsy. The depth should be proper. Like I should tell you, yesterday even I got a case of a lip biopsy and it was very superficial. I rejected that biopsy and said to the clinician that the depth is not proper. So kindly repeat it, because the it will not be representative, because then your diagnosis will be lying and you will later on say that, oh, the diagnosis was missed, but the lacunae was at the biopsy level. So just to
Okay.
see that the depth and the content of the biopsy specimen are adequate, then only you should accept that.
So the precision and accuracy of diagnosis depends on the quality of the biopsy given.
Very, that is true,
Yes.
sir.
And so any lesion, like to be specific, like this, like OSMF, I think it's better
No,
to rule out through biopsy because the conversion rate of OSMF to oral cancer, even though it's on a lower side, but still they are like the risk of malignant transformation is there. So it's better to take a step early for the diagnosis.
Okay, okay. Next question is, can initiating our general pathology lab with the help of franchisee of corporate labs like ThyroCare help us in establishing a full-fledged pathology lab? I think Dr.
yes,
Vivek wants to talk about general
yes,
pathology.
yes, Dr. Vivek, we can do that. And I must tell you that I know one oral pathologist who is working at a renowned corporate center. And POPMA will definitely write to all the corporate chains of diagnostic centers or the pathology labs to generate vacancies for oral pathologists as diagnosticians.
Okay. Next question is from a live audience, Dr. Srishti Arora. It was the need of the hour. Thanks for sharing so much wisdom as an MDS resident and candidate at AOPLM. I am grateful to see bigger. Okay, it was not a question, it was a compliment. Thank you, Dr. Srishti.
Yeah, thank you, Dr. Srishti.
Any erythematous or ulceration in OSM should be biopsied. Vital stain like toluidine blue can help. Okay, thank you, Dr. Akshay. Mm, Next question. Is it possible to practice oral pathology if we have to relocate multiple times? This is why is it exclusive to oral pathology? This should be a question by any branch and every branch, or even any previous general dentist.
Yes, yes.
Okay, so although your concern is valid, but it is not within the purview of this. Fine. Uh, how will an oral pathologist prove their signatory importance while applying for a job in labs that employ oral pathologists?
Yes. Um, you can search. I have made a pocket book for this signatory evidence, because I have collected all the evidences which constitutes around 800 pages. Now I concised it to 289 pages. So you can show them, and I've told that all these proofs are admissible under the court of law as the primary and secondary evidence as per Indian Evidence Act 1872. So you can
Okay.
show.
Okay. I think this part you have already covered regarding the signing of reports by an oral pathologist legally in India. You covered it extensively, the
All were
legal.
these were expected questions, sir. That's why I made it a legally oriented seminar, sir, or a presentation.
Excellent, excellent, excellent. And audience is loving it. And one more live question, Dr. Farnaz. Please give us some research institutes in India and outside.
See, shall I answer, sir, this
Yeah, please,
question?
please go ahead, go ahead, go ahead.
Yeah. Yes, there are research institutes in India like AIMS, where also recently two oral pathologists are working as research associates. Even ICMR has vacancies, and they have mentioned oral pathology. The even some vacancies they come with the MDS oral pathology. Otherwise, they come as only MDS. Even BDS with different like some specific years of experience, they are also eligible. And outside India, I'm not much aware. Yes, even Harvard, John Hopkins, all these MS, Slocan, those are there. And rather, even cancer institutes like in India, uh, like Rajiv Gandhi Cancer Institute, we have different regional cancer institutes pan India. So they offer different research areas where you can work, and you have to be open. Again, you may not be posted only for oral cancer research. You can be posted for a liver cancer research or breast cancer research. So but again,
Okay,
the morphology of the cells will remain the same, and you can utilize your knowledge which you have acquired during oral pathology PG residency.
great. Let us move to the next question. Would you like to give any suggestions while taking any franchise of corporate general pathology lab that may help us in the long run, especially in terms of financial investments?
I would
Yes,
like
you
to
can.
answer.
Yeah, you, Dr. Geetpriya, yeah, you can go.
No, because even I had associated with the
Yes.
corporate lab in the beginning, but frankly, like it takes a lot of time, and the return of investment is very low with them. Either you have to get that kind of work, like so many patients should be there, because it's a combination. You have to focus on hematology patients, and you can take help otherwise for the like histopathology, some cases where you are stuck and you are not able to diagnose those cases, or for further molecular diagnosis you can associate with them, like immunohistochemistry or PCR samples you want to send to them. That's how you can associate with them.
Okay, so that brings us to the end of the questions as well as tonight's session. So this was on a very unique topic. It was about unique careers and maverick journeys. I must appreciate the efforts of Dr. Bhuvan Nagpal in coming up with POPMA, Practicing Oral Pathologists and Microbiologists Association. It's a unique association in India. I was not aware that such an association exists, and the number is huge, 75 people who
Sir,
have
we
started
have
it.
a periodontist also in that.
Acha,
Yes.
okay, great,
We
great.
have a periodontist, Dr. Rutuja, and I want to like thank you, Dr. Rutuja, like for refining of my PPT, for giving the icing on the cake. So thank you, ma'am. And
Very nice, very
she
nice.
is one of the periodontist, and she is oral cancer screening consultant also.
Great.
Probably rare to find.
So, before we end up, I want to ask this question: is oral cancer screening, the numbers are increasing? Early stage screening and early stage detection, are those numbers increasing so that we are
Yes, sir.
preventing people from getting into much severe stages?
Sir, I encounter cases when they are almost in the metastatic stages,
Oh,
because I should tell you, even today I got some photographs. First, the clinician they send the photograph like this is the case, and I want to do the biopsy. So this is representative area is good. So by seeing, you can have an idea the extent, and then when the lymph nodes are involved, and majorly the cervical or the neck lymph nodes will be involved, and the patient is a chronic smoker, so your diagnosis is clear cut that it has reached to a level.
okay.
And when in different investigations like CT scan, they also give us a clue that it is malignant.
I think this is where AI is going to play a big role. Maybe as
Yes.
the models evolve further. I was a part of one of the projects where two students, college going students, had developed an AI screening tool, and I was guide for that project, and they won an award, and they have moved to USA, and they are doing their higher education there. That was my
No,
first,
even
yeah, that was my
uh,
first experience with AI tool, especially in precancerous lesions. Yeah, go ahead, please.
me and Dr. Geetpriya are also planning some study. It's Dr. Geetpriya's idea only,
Yeah, do it, do it, do it.
to incorporate AI for the histopathological diagnosis. Yes, and those things will be true, sir, in the near future, sir.
So
Who
actually,
thought
that's
of, sir,
the
10 years back that we will be having a live session at 10:30 in the night?
True, true, true. So maybe 10 years from now, there will be a full-fledged model developed by POPMA, especially Dr. Bhuvan and Dr. Geetpriya, which is
Thank you, sir.
widely being used across India and saving lives as well as improving the quality of life of a lot of patients. Let us hope for such a solution. And that brings us to the end of today's session. I thank once again Dr. Bhuvan for
Thank you, sir.
agreeing to come as the guest speaker of the day, and Dr. Geetpriya Kaur as the guest moderator and adding value to the session. And for all those who missed watching the session live, tomorrow we'll be sending a 5 point summary of the lecture. Along with it, we'll also be sending the link of the recorded lecture. You can watch the entire session with that recorded link. So that brings us to the end of sixth episode of season two. Soon we'll be announcing the topic of seventh episode along with the speaker's name, and again it will be a unique topic. Thank you for joining us for this session. Good night.
Yes, thank you, sir. Thank you.
thank you.